This video is a must watch before you start your clinical placements, or even if you've started, it's still valuable for you. Okay, so please do enjoy the video and let's get into it. This is the things that you must know before starting clinical placements as a med student. Okay. Ciao. Did y'all hear that? Oh my gosh. That is not back problems, God forbid, but that's as close as you can get. That's as close as you can get. Let's get started into this video. When I was starting out in my placements, it was second year that we were kind of introduced to the world of the hospital, and that was a big shift, big difference between the dynamic in lecture theatres versus the dynamic when you're supposed to be now in the hospital and supposed to still be getting value and still providing value. So I found that dynamic shift, or that difference in dynamics, so mind-blowing. Like it was so hard for me to settle into basically being a medical student in the hospital. And I know I was not the only person in this struggle. I know a lot of other medical students just felt useless. Like, if you could summarize how you'd feel as a second or a third year medic, sometimes you feel like a piece of decoration on the wards, because sometimes that's literally all you can do is just stand and look pretty, because your usefulness doesn't really kick in until about, I'd say, fourth or fifth year. So I really struggled with that dynamic change. And for me, I think my biggest issue was just not knowing what I was there to gain, and actually not feeling like I was gaining much whenever I'd go to placement, because a lot of the doctors were just not aware that they were going to have medical students that day, or maybe they were aware, but because of their busy schedule, they just weren't able to have enough time one-on-one for us to really get like that valuable teaching that we'd been so used to in years 1 and 2. It was a humbling experience, I'd say, and it is going to be a humbling experience for any medical student out there, because first and second year, you guys are the main character. You are what the medical school is all about. You know, your learning is tailored to you. Everything is tailored to you. Now you go into the hospital setting and nothing is for you. Everything is for the patient. You have taken a back seat in the entire operation. Your teaching is not even prioritized. It's patient care that's prioritized. So it's very humbling. You have to sacrifice your ego a lot, because you have to realize that, hold on, first of all, I'm really not the priority in this situation. In the hospital setting, it's the patient that needs the priority. And if the patient needs the doctor, he gonna go. He not gonna stay and teach you whilst the patient's calling. You know what I'm saying? So that's the main difference between non-clinical years and clinical years. You're just gonna have to adjust that shift of being second best. Not even second, I would say not even third or fourth. You're more or less the bottom of the food chain. So it sucks at the start, but you get used to it, and you get used to providing value, and then you get used to receiving value back from placements. One of my very first tips about if you're starting placement is just to introduce yourself to the doctors, to anybody who's on the ward, and just say, hi, I'm the third year medical student on the wards, or we're the third year medical students on the wards. Can we help you with anything? Or we are here to get some teaching. Is it okay for us to take some patient histories and present them back to you? Simple thing, you know, you come across to the doctors as having a clear understanding of what you're here on placement for, and you can also give them a brief overview of how they can aid you in your learning as well. I hope that makes sense. So introduce yourself, get comfortable with introducing yourself. Don't just come onto the ward and expect them to know who you are, because 9 times out of 10, boo-boo, that is not the case. Okay, they will not know who you are. They will not know who you are or what you are there for. So you need to introduce both those things when you come onto the ward. You might get lucky. They might know exactly, you know, who you are and what you're there for and all that stuff, but 9 times out of 10, they won't. I would say another add-on to this is always have a name badge or something that can show your name as well as you saying it, because I find that most people need the visual aid in order to be able to pronounce it correctly as well, but that's only if you have a difficult to pronounce name, like, you know, Fejiro or something else that's 3 syllables long. Sorry, I'm just throwing a little shade there. But anyway, on to my next point of the video, which is My second tip of the video is actually to come to placement with a plan. Nowadays, if I want to come to placement, I most likely go into placement with a brief overview of what I want to accomplish within that session. So I might have a timetabled session of 9 a.m. till 12 p.m. on my schedule. I may not stay that long because I know exactly what I'm going to placement to achieve. And once I've achieved it, I'm out. I am skedaddling, okay? There is no need for you to take the entire session if you do not need it and if you've already accomplished what you need to today. I find having a plan before you come to placement makes you very time efficient. One of my typical days might be a morning session like I described, and I might go onto the wards, and my plan is 1, to take 2 histories, to present at least one of them and to gain feedback from one of them. The way we gain feedback in our medical school is that we ask for an email address and we send what we call a mini KEX over, which is an online digital feedback form that you can get from a consultant or anyone basically who's in the hospital and can hear you present or see you do an examination and basically provide feedback that way. So those might be my 3 things that I'm going on placement to do. So as soon as I get onto the wards, I am focused. I'm like, hi, my name is Fajira. I'm a 3rd year medical student. I'm just here to take some histories and just present them to you. Is that okay? Do you know who on the ward is actually a really good patient for me to have a conversation with? And they're going to be like, yeah, I do. Patient X in bed 7 is actually a really good person to take a history from. They've come in with this, try and get more of their presenting complaint, and I'll be over there when you're finished so you can present it to me. That is briefly what my morning could look like because I've come with a plan and I know exactly what I want to get from that placement. So that is my second tip. Always come knowing what you want to get. Recently, I've been more focused on examining patients and getting my neurological examinations in because I'm on the elderly block, which involves a lot of neuro and stroke and all of that good stuff. So my focus whenever I come to placement is, can I get a neurological examination done on a patient today? And can I get some feedback from it? And overall, I've ticked off most of my actions for my placements in the first hour or so of me going on the ward because it allows you that ability to be really time efficient when you know what you're there to accomplish. My third thing that I would say is really, really valuable is do not just look for consultants as those to take learning from, okay? You can learn from anyone in the ward, especially nurses, ward sisters, which are the nurses in charge. You can learn from the pharmacists, you can learn from the physios, you can learn from the nursing students as well. They know their thing, they know their way around the ward and all that good stuff. So you can learn from every single person on the ward. There is no, I'm just looking for a consultant today and I can't find a consultant, therefore I'm so angry. Stop. That's not how we do things on the ward. You can learn from anyone. I've had really amazing teaching sessions from the ward sisters that have really taught me so much about the patients, how their journey through the hospital has been, and all of the things that they're now doing in their patient care and stuff like that. More than I've gotten from consultants because, of course, they are the big guys in the hospital, but they are not really into the patient's day-to-day activities as much as the nurses and the healthcare assistants are. So as much as, of course, we love to say, like, you know, you get more teaching from consultants or from people in the medic field, you can learn from anyone and everyone. So don't have a narrow spectrum of who to get learning from or who to present to, because I've done presentations to nurses and they've given me excellent feedback for the presentation that I've given them. So don't ever feel like I was only going to this ward to talk to this doctor and the doctor isn't there, so I'm going to go home. Don't do that. You can definitely learn from more than one person in your placements. So overall, I think I've covered the most important tips that you guys will probably need going on placements. I hope this has been quite useful. Let me know if it has, and then I'd love to do more of these types of videos where I talk you guys through some of the things I wish I knew when I started medical school, okay? I hope you guys have enjoyed this very much, and if you have, if you like the vibe, if you want to watch more videos, stick around on my channel. I'm going to link some more interesting topics that I've talked about that you guys can check out here, and you can definitely subscribe, give a like to this video. Let me know your thoughts down below in the comment section, and I'll see you guys in my very next video. Bye. Black, black, bitch. Always whispering.